Hi guys, it's Pierre the Physical Therapist, and today we're talking about sleep. And you might be wondering, hey Pierre, what does sleep have to do with my pain and what you do as a physical therapist? You ever notice that if you didn't get a good night's sleep, that just kind of messes up your whole day? Well, that's even magnified even more for those of us who have pain, because not enough sleep can lead to what we call central sensitization. And basically that means that things that didn't used to hurt now begin to hurt. So basically that cup that we have to fill that runneth over for you to have to cause your pain, that cup already starts half full when you don't have a good night's sleep. So what are we going to do to try to get better sleep? Well, first thing we're going to do is we're going to try to be consistent. So that means being consistent in your sleep time and being consistent in your wake time. A lot of studies suggest that you start to go to sleep between 10 and 11 o'clock every night to be consistent, so your body knows what time it's supposed to be when you're supposed to go to sleep. The other thing you're going to try to help with getting your body used to the idea of what time it's supposed to go to sleep, turn off those electronics. A lot of us are on our phones, we're watching TV right before we go to sleep, and that input is actually stimulating us instead of getting us to wind down. So for those of us who are having trouble sleeping, I recommend either meditation or music, something that's not going to give you a visual stimulation to get falling asleep. The other thing we're going to do is we're going to turn off the lights. A lot of times, we have the lights on, so that's also giving us that input that it's not time to sleep, that it's time to wake up. What about setting bedroom temperature? Some of the studies are saying 60 to 68 are the temperature that they recommend for optimal sleep. Don't know how that fits in what temperature you normally set your room to, but a little bit cooler temperature is usually what they say to kind of get you better sleep. And the other thing is caffeine intake. Some of us are coffee drinkers. I'm not particularly. If you're drinking coffee throughout your day, that caffeine again can act as a stimulant to kind of keep you awake. So they're suggesting that you stop your coffee intake after 12 noon. That might be a huge change for some of us, but just keep that in mind as far as what are the things that you're doing to set yourself up for success for sleeping. The other thing is that as far as where I come in, if I've given you some homework to help you manage your pain, do that homework right before you go to bed. Even though I say, hey, let's do it every 2 hours, and you just did it an hour ago, still do it right before you go to bed, even if you just did it an hour ago, to see if that can help set you up for success. All right, Pierre, so now what do we do when it's time to go to sleep? I have a couple of different suggestions for people who are either back sleepers or side sleepers. We usually don't recommend that you sleep on your stomach. And I have some pillows set up, and I know what you're thinking already. Pierre, I toss and turn. Those pillows are going to be on the floor. Well, maybe you're tossing and turning because you're not in the right position anyway. So these are some things that you can give a try to see if that decreases your tossing and turning. So if you're a back sleeper, what we recommend is that you kind of get in that zero gravity position. You know how some people say they sleep in a recliner? Well, don't sleep in a recliner. You can kind of simulate that zero gravity position in the bed. If you don't have a wedge, you can have one pillow the regular way, one pillow a long way. That brings your head up. And then you can put a pillow or two underneath your calves. I say under your calves and not underneath your knees, so you can get that zero gravity position. So that's what we recommend for our back sleepers. For our side sleepers, you just want to be careful that, you're not a 5-pillow person that's cranking up your neck here. We'd like you to be pretty neutral, so you might have to play with the number of pillows you use. 2 pillows may be too thick, so you may have to do 1 pillow. 1 pillow may be too thin. You may have to do 1 pillow and then maybe put a towel or blanket underneath it to get it just right so your neck's in neutral. If you don't have a contoured pillow, or if you're not one that smushes the pillow to kind of make up the space between where your ear hits the pillow and your neck hits the pillow, you can just put a small hand towel at the base of your pillowcase to make up that distance. And then I know some people might say, well, should I put a pillow between my knees? I want you to put a pillow between your knees, but also have that pillow a long way so it's between your knees and your ankles to try to keep your pelvis in alignment and to try to decrease the rotation at your hips. So back sleeper, try to get that head up, feet up. Side sleeper, get a pillow between your legs. Make sure you're not 5-pillow guy or gal where you're putting a lot of stress on this side of the neck, crunching off this side. And some people also find relief when you're on your side. You create a pressure point at your hip and your shoulder. And then you have this empty space here. Some people find relief if they put a small blanket or towel to kind of make up that curve there. Those are just things that you can give a try to see if they get you in a position to help you sleep better. I talked about regulating the temperature, being consistent with your sleep and wake time, shutting off the electronics, turning off the lights, and maybe decreasing your caffeine intake after 12 o'clock or so. And again, what I say, movement is so very important. Do your homework before you go to sleep. See if that kind of gives you some good equity in helping you go to sleep. Move efficiently, move effectively, and in this case, try to get some good rest. Have a great day.